Hi, my name is Kieran Berry, and this semester I've been working with the Chronic Care Committee focused on type 2 diabetes management. For this quality improvement project, I'm going to be focusing on oral hypoglycemic agents for type 2 diabetes management. Currently, I live in Durham County, which is near Duke's campus. As such, I've decided to focus my QI project on my local community. In a poll conducted by the Durham County Department of Public Health, diabetes was recognized as the leading concern for the community, coming ahead of cancer, heart disease, and mental health concerns. Within Durham, diabetes has a 12.9% prevalence rate, which is higher than the North Carolina average. In North Carolina alone, spending on diabetes is expected to surpass $17 billion annually this year, equating to roughly $33,000 per patient a year. However, social determinants of health play a large role in diabetes management, both nationally and within Durham, with lower socioeconomic classes and certain races facing significant inequities in quality of care. At a national level, it has been found that lower socioeconomic class individuals are less likely to be prescribed newer diabetes medications due to cost, thus widening healthcare gaps and placing undue stress on patients. The intervention of this QI project is to optimize oral anti-diabetic treatment regimens according to the American College of Physicians guideline for oral pharmacologic treatment recommendations as a way to decrease feelings of anxiety, improve diabetes treatment satisfaction ratings, and lower hemoglobin A1C in newly diagnosed type 2 diabetes patients. This intervention will take place over 1 year in Durham County. Newly diagnosed is defined as within the past 3 years for the purposes of this study. I'm so sorry, my dog's drinking water. This intervention was based on existing quality of life and oral anti-diabetic regimen data. According to the proposed guideline, newly diagnosed patients tend to prefer PO treatment regimens. The recommendation is to begin patients on metformin as monotherapy. If combination therapy is necessary, then patients should be included in the discussion of adverse effects and cost analysis to ensure success in treatment regimen. Recent research has found oral treatment regimens to be superior to injectable insulin therapy in lowering hemoglobin A1C in newly diagnosed type 2 diabetes patients. Furthermore, the utilization of PO regimens has been found to yield better quality of life scores when compared to injectable therapies. Previously, insulin was preferred by some physicians due to its ability to preserve pancreatic beta cell function. However, with the advancement of medications, newer oral anti-diabetic agents are demonstrating the same capabilities. Lastly, socioeconomic distress has been found to impede diabetes management, demonstrating the devastating consequences of lower quality of life associated with diabetes management on achieving adequate disease control. Here's a brief illustration of a study performed by Lee et al. In 2024. It illustrates the comparison of early insulinization versus oral anti-diabetic regimens in lowering hemoglobin A1C levels over 36 months. This shows the superior effect of oral medications for this patient population. Through this intervention, we aim to improve the treatment satisfaction scores of disease management by 10 plus points as measured by the Diabetes Treatment-Related Quality of Life Questionnaire. Simultaneously, we aim to reduce hemoglobin A1C levels by 1% for newly diagnosed type 2 diabetes patients in Durham County over the course of 1 year. We will know that this change is an improvement if the median decrease in hemoglobin A1C levels in the selected patients is at least 1%. Furthermore, an increase of a mean 10 plus points on the quality of life survey denotes lower anxiety, lower burden of disease on ADLs for patients, and a decrease in adverse effects. Prior to implementing the QI project, the planning phase must occur. The Duke Endocrinology Clinic has been identified as the desired setting for this project as it is located in Durham County. This QI will take place over the course of a year. Key stakeholders include newly diagnosed type 2 diabetes patients within the clinic advanced practice providers and physicians, as well as clinic staff providing medication education and surveys for the project. During the do phase of the QI project, patients will be identified and baseline data will be collected. Additionally, providers will be educated according to the guideline, including diversity training and socioeconomic determinants of health education in order to best address the concerns during the combination therapy initiatives. After the baseline data and education is obtained, the guideline will begin to be implemented. Patients should be placed on metformin as a monotherapy. However, if they're already taking metformin as a monotherapy, since they've been diagnosed within 3 years, and they have not achieved adequate glycemic control, then those patients will be implemented on combination therapy. Data will be collected at clinic visits monthly, including quality of life surveys, hemoglobin A1C levels, and medication adherence. The medication adherence is going to be determined by pill counts and numbers of prescriptions refilled. At 6 months, if patients still have a hemoglobin A1C of greater than 8.5%, then combination therapy should be implemented according to the guideline. At the 1 year mark, the do phase is complete and analysis should begin. This leads us to the study portion of the project. Inferential statistics can be utilized to identify the proportion of patients achieving hemoglobin A1C less than 7%. Additionally, it can be used to analyze the proportion of patients experiencing a decrease of at least 1% of their baseline, which is our goal. Descriptive statistics, however, can be used to analyze the median change of quality of life scores throughout the project. Finally, these scores can be assessed according to medication adherence data and cross-matched using ANOVA testing. Following the study phase, we'll enact the ACT phase. This will help tell us what our next steps are. Improvement is defined as quality of life scores increasing by a median of 10 points and average hemoglobin A1C levels decreasing by 1% over the year. If improvement is demonstrated, further combination therapy utilization per the guideline should be implemented if the hemoglobin A1C level remains greater than 7. If improvement in quality of scores is demonstrated, it's important to consider outside factors that may have influenced the results. If no improvement to the quality of life scores is found, however, it would be beneficial to consider interviewing the participants to better understand needs of community members. If hemoglobin A1C shows no improvement, analyze medication adherence and determine if further education needs to be given to patients and begin the process again. And then here is my references.